everyone. My name is Halima Siddiqui, and I'm the project coordinator at Health Nexus. Health Nexus oversees several provincial initiatives related to FASD. The FASD provincial website, where you can find recent and up-to-date information about what's happening, learn more about resources and tools, and find out services available in your local community. We also allocate subsidies every year to 40+ support groups for individuals with FASD and their families. And we designed an online training for service providers from various sectors, including healthcare and nursing, education, mental health and addictions, justice and corrections, and community and social work. Before we start the presentation, we would like to begin by acknowledging the Indigenous people of all the lands that we are on today. While we meet today on a virtual platform, let's take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous people and their cultures. From coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nation people that call this land home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we can each, in our own way, try to move forward in a spirit of reconciliation and collaboration. A couple of house rules before we begin. During the presentation, you may be tempted to ask questions at the end about yourself or loved ones with FASD. Please do not use any identifying information to protect people's privacy. By law, we have a duty to report to Children Aid Society or the police any threat to a child or direct attempt to harm yourself or someone else. Presenters cannot provide clinical advice, as this would require professional counseling and more in-depth knowledge of the situation and behaviors at stake. Today's discussion provides information about latest research, evidence-based practice, or general education tips and advice. If you need ongoing support, please consider connecting with your local FASD worker for supports or join one of our Health Nexus support groups for individuals with FASD and their families. You can find this information on our website, fasdinfotesaf.ca. Now I'd like to introduce our speaker today, Dr. Kim Harris. Dr. Harris is the Executive Director of Navigating Onward in London, Ontario. NavOn provides multidisciplinary assessments for individuals living with the impacts of prenatal alcohol exposure, as well as other mental health and psychological services. Dr. Harris has directed multi-year grants to support children and families living with FASD and has provided leadership for a number of community collaborations related to FASD and culturally responsible and collaborative assessments. As a licensed forensic psychologist, she also maintains an active caseload, including assessments for court, and has been declared an expert witness in FASD. She conducts training and program development on FASD she conducts training and program development on FASD in the child welfare and justice sectors. She is an adjunct professor in the faculties of education and social science at Western University. She mentors graduate students and has published research articles, clinical guides, and book chapters. We are thrilled to listen to her presentation. Please ask your questions in the Q&A at the end, and we'll provide more information and links in the chat if need be. And with that, Dr. Harris, the floor is yours.
Okay, welcome everybody. It's really nice to see lots of familiar faces, or at least names on the screen. I am joined by Katrina, who is one of our psychology residents this year. And so she has been leading the running of the groups that we're going to be talking about today. And so I'm going to turn it over to you, Katrina, to share your screen and to take us through some of the great work you've been doing with some of our teens with FASD.
Okay, sorry, it took me some time to unmute myself. Can everyone see my screen just fine? Perfect. Okay, so good afternoon, everyone. Thanks for having me. I'm very excited to be here today. I'll be talking about a social skills intervention program called Skills and Chills, which is a program designed at our clinic by Dr. Ashley Biltfell for individuals with FASD and other neurodevelopmental disorders. So my name is Katrina Aranis, and I am a resident at Navigating Onward, as Dr. Harris had mentioned. I have about 5 years of experience working with children, adolescents, and their families in a clinical setting. As a resident, that basically means I am in my final year of training to become a psychologist, which means my work is supervised by a registered psychologist. And for Skills and Chills, I'm fortunate to be under the supervision of Dr. Kim Harris. So that's Dr. Kim Harris, my supervisor. I would also like to acknowledge the following people for their hard work. So Dr. Ashley Bidwell, who came up with this program, Megan Mueller, who is the other resident at our clinic. She's co-facilitating the current Skills and Chills program with me this spring, and other student learners who have been a wonderful help throughout throughout Skills and Chills, and of course the clients and their families who have provided feedback and who have joined Skills and Chills. I'd like to begin by discussing social skills in individuals with FASD. While they have many strengths, such as initiating conversations, inviting their peers to join their preferred activities, and showing concerns for others, they also face challenges. For one, children with FASD often struggle with understanding social cues, and they fail to recognize the consequences of their actions. They often withdraw and they struggle with turn taking. So, for example, during a game or conversation, they might interrupt frequently, talk over others, or repeat the same ideas. The other thing, too, is individuals with FASD often have difficulty interpreting others' emotions and mental states, which could be a problem. So, what do I mean when I say social skills? Social skills involves being able to select appropriate friends, make appropriate friends, and maintain that relationship. It also involves interpreting, understanding, and communicating feelings in a give and take relationship. Social skills include understanding social expectations, such as giving others personal space, picking up on social cues, and adjusting behaviors based on the situation. So it's quite complex. There is actually very little research on social skills intervention for individuals with FASD. One notable study was conducted by O'Connor and his colleagues in 2006. So they examined this program called Children's Friendship Training, or the CFT program. And the study included 100 participants aged 6 to 12 with an FASD diagnosis. So the 100 participants were divided into two groups. One group, so about 50-50, one group completed the CFT social skills program, and the other did not receive the intervention until after the study ended. So they could compare the group that received the CFT to those who did not. So those who received the CFT group, they participated in 12 weekly sessions, each lasting about 90 minutes. And these sessions incorporated instruction, modeling, rehearsal, feedback, and homework. Meanwhile, parents attended separate concurrent sessions where they received guidance on FASD-related challenges and the key social skills their children were learning. And results showed that children with FASD who completed a CFT program demonstrated significant improvements in their understanding of appropriate social behavior, which after a 3-month follow-up, so 3 months later, they maintained that appropriate social behavior, the skills that they learned, which is super cool to see. Additionally, parents reported that those who were involved in CFT program was effective in enhancing social skills and reducing problematic behaviors. So PEERS, which stands for the Program for the Evaluation and Enrichment of Relational Skills, is a parent-assisted intervention focusing on teens in middle school and high school who are having difficulty making or keeping friends. So it's basically the developmental extension of the evidence-based program, Children's Friendship Training, or the skills program that I was just talking about earlier, the CFT. PEERS has been tested most extensively on teens with autism spectrum disorder and to a limited extent on teens with developmental disabilities and fetal alcohol spectrum disorder. So this intervention includes, like the CFT, a separate parent and teen sessions that meet at the same time for 90 minutes each for about 14 weeks. The group focuses on skills like having conversations, entering and exiting conversations, using electronic forms of communication like TikTok, Instagram, choosing appropriate friends, handling teasing, bullying, and other forms of social rejection, handling disagreements with friends, and having appropriate get-together with friends. Now, one critique in the literature regarding social skills is that individuals often do not spontaneously transfer the skills that they learned in programs to natural environments, whether it's at school, at home, with their cousins, or whatever have you. The other critique in the literature is that these programs often tend to be lengthy and quite time-consuming for both the parents and the teens. And so Skills and Chills is a program aimed to address those key concerns in the literature. It's an 8-week program, shorter than those 2 other programs, that is based on 2 evidence-based programs. Specifically, it combines the interpersonal effectiveness module from the Dialectical Behaviour Therapy, or DBT, with the more sophisticated social skills lessons from the peers program. So the interpersonal effectiveness module in DBT focuses on teaching individuals how to communicate more effectively and navigate relationships in a healthy, assertive way. Skills and Chills is taking this module that is designed to help people improve their ability to manage interpersonal situations without feeling overwhelmed or disregarded. Skills and Chills is also taking the more sophisticated skills taught in the peers program, the program that I talked about earlier, which is basically skills that involve managing more complex social interactions. So for Skills and Chills, the content is significantly simplified and there are streamlined handouts for all the skills taught that's provided to both the youth and their parents. So the lessons in Skills and Chills are outlined on the slide in the following order. We begin by focusing on emotion regulation in the first week. This basically involves teaching how to manage our feelings when we feel upset, frustrated, or angry. And then in the following week, we cover conflict resolution. So this skill is introduced early on, so it can be used when conflict naturally arises in the group. As the program progresses, we explore additional topics, including how to communicate wants and needs in a clear and respectful way without being passive or aggressive. We also focus on building and maintaining positive relationships, maintaining self-respect, and handling teasing, bullying, and gossips and rumors. So each session follows a consistent structure. We begin by checking in with each other and providing a rating from 0 to 10 of how we're feeling that day. Next, we review the group rules and the points or reward system that we have, which helps highlight positive behaviors rather than focusing on the negative. This could include simple actions like raising your hand before speaking, or sitting quietly and listening, or actively engaging or doing your homework. Then we introduce and teach a new skill, followed by practicing that skill to ensure that the teen is understanding the skill that we're teaching. We then wrap up by reviewing what we've learned and then assign the skill for homework. Afterwards, we have snacks, and then we transition into chill time, which is a vital part of the session. So during the chill time, we play board games together or whatever games the teen would like to play that day. So during that time, natural conflicts tend to arise. And so leaders are there to provide coaching on which skills they could use and how to apply them in real-time situations. Skills and Chills is definitely a work in progress, but so far we've found several key elements that work really well. So we take a neurodevelopmental approach, which basically means we strongly believe that young people do well when they are given the right support. Young people do well when they can. At the core of our sessions is a well-defined structure with clearly articulated rules. So much so that we have the rules printed, laminated, and taped on the table in front of each participant. So these rules are reviewed at the start of every session to ensure everyone is on the same page. While we adhere to this structure, we also remain flexible and adjust to meet the unique needs of each participant that we have. One thing we've found particularly effective is reminding teens when they forget a rule. So like when they forget to raise their hand before they talk, or a bunch of teens are talking at the same time. Instead of focusing on the mistake, we gently redirect them to the rule that's visible in front of them. So this approach encourages accountability while keeping the environment positive and supportive. We also repeat key content and skills throughout the program to really reinforce learning and ensure that the material sticks. What truly stands out about Skills and Chills is the opportunity to connect with teens in a positive, fun, and engaging way. So it's not just about teaching skills, it's about getting this chance to hang out with them, providing a space where they feel they truly belong. As previously mentioned, teens with FASD often have consistent negative interactions and experiences because of struggles with social skills. So creating a space where they can have positive social interactions is a highlight for Skills and Chills. Additionally, we maintain a high staff to teen ratio. In our latest group, in our last group, we had a 1-to-1 staff to teen ratio, and this time around, we have approximately 1.5 teens for every staff member. So this allows us to offer more individualized attention and support, ensuring each teen's
It's
needs
2 to
met the
5 years, and you can get like $250,000. So it would pay my salary. It would pay,
So throughout the sessions, we've seen a noticeable increase in teens' engagement. At the start, we often needed to call on their names to get their attention. But as the program progresses, they become more self-motivated and eager to participate. By the end, almost everyone is enthusiastic about volunteering, and there's no really need to call out on anyone because they just want to volunteer. One of the highlights of the program is the graduation party, which is entirely decided by the teen. So they get to choose what they'd like to do for the final session to celebrate, whether it's having a pajama party, watching a movie, or something else entirely. The last group that we had simply wanted to hang out and have a chance to chat more with their peers, with their facilitators, which was a wonderful reflection of how comfortable and engaged they had become. We had received a lot of positive feedback from both the youth and their caregivers. One youth from last year even wanted to repeat the program, do the program again, which I think speaks volumes about the impact it had on them. Another feedback we had from parents is that having a parent component was a bit time-consuming for some parents, so the parent component of the Skills and Chills program was removed. However, last night, during our first night of the spring Skills and Chill session, when one of the facilitators went down, she saw the parents just hanging out there and having like a community. They ended up staying, which was very heartwarming to see. So far, there have been 10 students who completed FASD training and attended an FASD conference, which has greatly enhanced our understanding of both the theory behind FASD and the lived experiences of those with FASD. So this really helped deepen our understanding and awareness of FASD, which is crucial in supporting the teens that we work with. To continue improving the program, we are now implementing pre and post measures along with ongoing progress monitoring. So we ask the youth to fill out questionnaires. This will allow us to assess the effectiveness of the program empirically and make data-driven adjustments to better serve the future participants we might have. So our goal really is to continuously refine Skills and Chills to make sure that we provide the most meaningful and impactful experience for every teen who joins us. And that is it for my presentation.
So, first question, what was the biggest challenge you encountered running this group?
I would say one of the biggest challenges running this group is the preparation piece, because you just don't know what kind of group dynamic you're getting. Just reading the referral or talking to parents, you just don't know how teens would be interacting. I would say is one of the challenges we've had.
I can offer from an organizational standpoint, one of the because we've been running a teen and youth group for many, many years, not specifically social skills, but we've always run a parent and concurrent kids group or teen group. And one of the things that we recognize over the years is that the facilitators really do need to be trained very specifically in FASD. And so as part of our Health Nexus funding to run this program, one thing that we can do is really make sure that the people that are running the group are very well trained. So we do internal training, of course, with all of our new students and residents and with our staff, but it also allows us to get access to the CanFASD training. So anyone running the group has done all of that training, as well as our internal training. And then they attended the conference this year as well in London, which, as you all know, has 3 parts, or as many of you probably know, has 3 parts. A big emphasis on lived experience, on clinical interventions, as well as some of the basic research that is being undertaken in the field of FASD.
On the offside, what was the most fulfilling moment for you?
For me, it's really hanging out with the teens and seeing their engagement increase over time, getting positive feedback from the teens. Like last night, there was a teen who didn't want to be there, but as the session progressed, they were getting more comfortable. They were engaging a lot more. And by the end of the session, they said, this was really good. So just hearing that positive feedback from teens was very, very rewarding.
Kim, did you want to say something as well?
Sure. I was just going to say it's really fun to have an agency full of teens who are, engaging in service and hanging out with some of their friends, and even some of the other clients who are not at all related to the group, because we see clients through the evening as well. We're like, oh wow, it's really hustling and bustling in here, and I think it really brings a very, very positive atmosphere to the clinic, the staff, as well as everyone who's engaged with the group, and even people who are not at all related, but are, at the agency at the time that the group is going on.
How did you attract participants to this group?
Okay, this is I can answer this one, Katrina. So when we first ran it, we had a lot of difficulty getting some uptake. So this is our 3rd year running it, I think. So we ended up just reaching out to people that we know who worked with people with FASD. So that's one way. We do diagnostic assessments as well. So when we give feedback to the clients, we let them know that there's a range of groups available, and we include skills and chills in there. So now it's becoming a little bit more well-known, I think. And so recruitment has not been as much a struggle, but we take a multi-pronged approach, I would say. One is to have reach out individually to people who are working with clients who may be interested. One is by letting people know through the diagnostic clinic that there are these options available. And then we send an e-blast out to, I think we have about 2,000 people on our email list. So we send out an email, and Health Nexus helps as well, because they promote it. They invite us to do a talk like this. It's on the website if people search it. So it's really kind of a multi-pronged approach in terms of recruitment.
Thank you for answering that. Next question is, do you have plans for sustainability of this program and running it again?
Yeah, so I have to say that the Health Nexus funding is very, very helpful because it allows us to do things like get snack, like we're a not-for-profit, so it allows us to get snacks for the kids, to do some, get the materials that they need, like the booklets they need and things like that. So that is extremely helpful. As a social enterprise, part of our mandate is to give back to the community. And so this is one of our areas of give back. So although Health Nexus is really critical to the running of the group, we, as part of our student programming and part of our give back to the community, we would, just invest the time like on it, like pro bono to continue it. So we have a couple of areas where we give back. One is in some of our work in suicide prevention, intervention, and postvention, and one area is FASD.
This is a bit of a two-part question. If we wanted to replicate this program in our region, what should we consider? And also, what background or training should we have?
So we are very open to sharing resources and to helping people. So if there's interest in running the program in your community, then I would just suggest that you reach out to us and we can share some of our materials and things like that. So that would be the first kind of infrastructure of the program. I think having a good network of people who can, reach out to participants who might be interested could be really helpful as well. So, having good relationships with your local FASD workers to be able to, spread out the program and also, look through their own list of clients so that they can share some of the information about the program. And the second half of your question, Halima, besides lessons learned. Oh, training.
Sorry, I didn't realize I was on mute. What background or training should they have?
So from my perspective, the training is really critical. So I think that people need to be taking some FASD specific training. And there's various avenues to get that. So, Health Nexus has their training. CanFASD has additional, more in-depth training. All of the people that do run the Skills and Chills, like Katrina and Megan, also do diagnostic assessment. So they have a really good understanding of the strengths and needs and the spectrum of issues, both strengths and challenges that people with FASD have. Just, I think being, embedded in the community. So attending talks, going to the conferences, encouraging staff to do that, I think is really important, because you can read things, but, talking with people who really have the lived experience really just deepens your knowledge and understanding. And I think you get that mostly through interacting with groups and groups like this, but also attending conferences and those kinds of things. I don't know, Katrina, if you have what your thoughts are on training. I think you came into it with very little FASD training, right? Although lots of mental health training.
Yeah, I certainly agree with you, Dr. Harris. Like that training was very empirical for me. Like I can't imagine myself doing Skills and Chills without that training. Like it really helps deepen my understanding of this diagnosis.
I also think, having a mindset of belonging is really important. So we've run children's and teens groups for many, many years, 12, 15 years now. And one of our main goals is that kids don't get kicked out of the group ever. So it's really because the kids are getting kicked out of like camps, or they get kicked out of, their classroom. Or so when they come to us, we really don't want them to be to have that experience. So this is why one of the reasons why we have this super high staff to participant ratio, so that if someone needs some support, then we can take them out and talk to them and help them regulate their emotions, co-regulate their emotions with them, and then gradually kind of bring them back into the group. So that's always been a really important aspect of the service that we provide to young people who have FASD.
Perfect. Thank you. Next question that we have here is, how was attendance at your groups? Did any participants drop out?
I think we did have, over the past few years, I think we have had one person drop out. Not last time. This time I think it's very unlikely. The kids are pretty engaged. But the first time we ran it, and the person was just not ready. They had quite a lot of social anxiety. And so our feeling, so they didn't want to come back. So what we did instead is we met with them individually to try to address some of those social anxieties to get them kind of more group ready. So it wasn't the group itself, it was more the individual characteristics of the person, and they just probably needed a little bit more individual support in order to manage social anxiety symptoms before they were ready for a group setting. But otherwise, we've had really very good attendance, which is actually pretty good for a group, because we've run a lot of different kinds of groups, and usually there's a number of people that come for a couple times and then don't continue to come for like a whole host of reasons. But yeah.
Do you think these groups could be run virtually?
So we did run groups virtually during COVID. I think it would be very difficult. I think one of the advantages of the program is a lot of the hands-on skills. So it's kind of like a board game cafe, right? Like they learn all these skills and they can implement those skills playing board games, which, generates a lot of opportunity for social skills use. And a lot of those games are hands-on and live. So, I mean, we did have some success with our online groups during COVID. People attended, but it wasn't the same purpose. That was more just about connection, not about skills teaching. And so, I'll let you weigh into, Katrina, but I really think a really important part of the group is being able to monitor the nonverbal cues of the teens, being able to intervene, coach when necessary, and all of that is a lot harder to do online.
So thank you very much, everyone, for joining from across the province, and for our participants for listening in.
Thank you very much.
Thank you.
Have a good day, everyone.